Hello everyone. This is again Casada Owen from the Innovate, and today I'm here to take you through atrophy and hypertrophy, which are part of the cell disturbances of growth. Yes, so basically I'll start with atrophy. Atrophy is defined as the shrinkage in the size of cells due to loss of the cell substance. And this atrophy usually occurs in cells that have attained full development. So if you're to see that if a number of cells have been atrophied, then the tissue or the organ where these cells are will be referred to as an atrophic tissue or an organ. Now these atrophic cells in most cases they have diminished function, but however much they have diminished function, they are not dead. Therefore, they can perform a certain little function. However, this atrophy can progress into cell injury if it goes on to extents that are too severe. So, as we have seen, that our atrophy is just shrinkage in size of the cell. So, the cell numbers are not decreasing or increasing, but just the cells are increasing in size due to they are decreasing in size due to loss of substance. Now, what are some of the causes of atrophy? So, the causes of atrophy are basically classified into two. We have the physiological causes, and also we have what we call the pathological causes. So, the pathological causes are those ones that are basically related with lesions or due to cause of a disease, whereas the physiological and those ones that are related due to the physiological changes within the body. Now, one cause is the physiological causes. So this one, the cause is the cessation of the physiological function of the cells. And an example I can give is the decrease in the size of the thymus gland if an animal reaches sexual maturity. Then also the involution of the uterus after pregnancy. So after the animal giving birth, usually the uterus goes back to the norm. And then also the mammary glands after lactation. That when before this animal has just produced, the mammary gland will be so big, but then after producing and after the lactation period has elapsed, the mammary glands go back to normal or they shrink. That is due to atrophy. And the other one is senility. Senility just refers to aging, but this aging usually occurs generally to the old cells within the body. It can happen, and this is observed majorly in old animals. This atrophy. So an example I can give is the organs of reproduction, like the testes. These ones are the first to show the senile changes. So they atrophy, they become small as the individual or the animal ages. Then we have starvation is another cause, and this is basically due to the inadequate nutrition. So during starvation, as you know that during starvation, glycogen and fat are the first to be utilized by the body in cases of supplying energy. And then after there, the body resort to the protein of the body macerator. And lastly, to tap the protein of the vital organs. So when it taps the protein of the vital organs, now that is the eating up of the cell organelles basically, and also the cells within these organs and tissues. And so in the this case, it will result into atrophy or shrinkage of these cells. Then we have disuse, that as an organ is usually not used, so it has decreased workload, the resulting cause will be that it will shrink. An example is when a broken limb is immobilized in a plaster cast, it can cause muscular atrophy, whereby these muscles will atrophy, will become small. And this basically, we can also see it in the race horses. If they are kept within areas for a long time when they are not working, their muscles will shrink. Then the other one is denervation or neurotrophic cause. So denervation is just the loss of innervation. And this one basically, we know that in muscles to work, they usually depend on the nervous supply of these muscles. So if they don't have enough innervation or they lose innervation, of course they will atrophy or they will become incapable of working, and in the so doing they will atrophy. So an example here I can give is the suprascapular nerve. If it is injured in the horse's shoulders, it will cause atrophy. Then we have the angiotrophic. So angiotrophic is just due to the diminished blood supply to the certain organs within the body. So this can result into anemia, ischemia, or chronic congestion. But this is usually seen in the central lobular region of the liver. So if the central lobular region is not supplied with blood, the cells within there, those are the hepatocytes, will now start eating up the cell organelles inside by these lysosomes and other things, and obviously that will cause hypertrophy. An example is still in the horse, the horse's hind limbs, that occurs when the parasite called the Strongylosis larvae invades this limb. It will occlude the femoral artery, and when it occludes it, obviously the tissues within down there, they will atrophy, and the hind limb, obviously. Then we have pressure. So pressure, this is just due to the pressure continually applied to cells over a long period of time. So this is commonly observed in tissues that are adjacent to tumors, abscesses, and hematocytes. Of course, tumors, and basically here we shall be looking at the benign tumors, those ones that keep on enlarging. So as they enlarge, they will be pressing against other organs or cells. And in the so doing, these organs, the cells within these tissues will shrink, and that will cause atrophy. And the example there we can give is the saddles that are placed on the shoulders and necks of the horses as they want to do work. And in the so doing, these will overpress. If they are so heavy, they will press the cells near these shoulders and they will atrophy. Then we have the endocrine causes. In most cases, we call them the hormonal causes. So the cause here is basically described as just the loss of the endocrine stimulation or an excessive secretion of the endocrine hormones. So if there is an example is if there is hypersecretion of the thyroid hormone, the resulting cause will be emaciation of the muscles. This is seen in cats and dogs if they have hypersecretion of this thyroid hormone. Yes. Then the other one is estrogen. If it's produced, that is produced by the testicular tumors, is going to cause atrophy of the seminiferous cells and also the epithelium lining these tubules. Yes. So from there, we shall look at the adaptive response of atrophy. How do some of the cells respond to the issue of atrophy in cases of in a way that they should adapt to it? So, as we have said that some causes are physiological and others are pathological, but all of these ones have the similar cellular changes that occur. And so the adaptive response of cells is that they will represent a withdrawal to a smaller size at which survival is still possible. The way they will respond that if these cells have started shrinking to a level that they cannot perform their normal function, so they will go to a smaller size and start performing at that size for them to function. Now, what are the classifications of atrophy? So these classifications, basically, as we know that in atrophy, the other thing to note is that the cells will become small, they will shrink in size, but in the so doing, even they can disappear entirely. So all these classifications, all types of atrophy even, depend on what tissues are replacing these lost cells. As we shall be seeing the appearance of the atrophic tissues or organs. So one is the fatty atrophy. So in fatty atrophy is where the lost cells are being replaced by the adipose cells or tissues. Whereas in fibrous would be the lost cells are being replaced by the fibrous cells. And then in pigments, the lost cells are being replaced by different pigments. It can be melanin, like that. Any other pigment within the body can replace them. Then mucoid atrophy is where these damaged cells, atrophied cells, will shrink to a size and then disappear to form mucoid substances. So in case that the lost cells are going to form, the cells that have been atrophied will form mucoid substance. Then simple atrophy is where is a type of atrophy in which the reduction of these cells will occur if none of the above changes occurs. For example, fatty, fibrous, pigment, or mucoid. If the lost cells are not replaced by any of those ones, then that is called simple atrophy. So, what is the biochemical mechanism of atrophy? How does it come about? We know very well that what brings about this is that it affects the balance between the synthesis and degradation of the proteins within the cells. So decreased synthesis and increased catabolism or both may cause atrophy. If there is decreased synthesis or increased catabolism within the cells can still cause atrophy. Now, in the so doing, the body has a mechanism of regulating protein degradation because it is a primary cause and it plays a role in the atrophy. So the body has two systems, the two proteolytic systems that exist to regulate this, and one of them is the lysosomes, which contain hydrolytic enzymes that can eat up the cell organelles or the proteins within the cell and other damaged or used up cells. So, and then it has also the ubiquitin proteasome pathway. So in here, that the damaged cells or the cells that have been shrinked, they will bind to the ubiquitin, and then they will be phagocyzed and then eaten up into these proteasomes. Yes, and then eaten up by the proteolytic enzymes. So, what is the appearance of atrophy? Macroscopically, what we see, or grossly what we can see, is that there will be a decrease in size of the organ. But of course, this is not the preliminary way of determining that is atrophy. Then also the part where atrophy is occurring, or the atrophied area, will be flabby and will also be soft, and then the tissue will lose its tone. And then the tone is like the color, the consistency in the coloration. But then also it will lose the tissue color. Yes. Then microscopically, what we can see is that the cells will become smaller, fewer, or entirely these cells will disappear. So you'll be seeing a space. And also within these tissues, you'll be seeing autophagic vacuoles that will contain the breakdown of these substances. So they are membrane vacuoles within the cells that contain fragments of cell components. Yeah, the cells that have been eaten up, the cell tissue or substances that have been eaten up will be stored in these autophagic vacuoles. That's what you see. So lastly is we are looking at hypertrophy. So hypertrophy is just the increase in the size of cells as a result, and then it will be the increase in the size of the organ. So in hypertrophy, the cells are just increasing in size, but as a result, even the organ increasing in size, unlike in atrophy. So this hypertrophy is not due to cellular swelling. The cell is not just swelling, but it's because of the increased synthesis of structured proteins and organelles. The more proteins and organelles that are being deposited within the cells are the ones that are causing the cells to swell and increase in size, but not just cellular swelling. But we know that pure hypertrophy occurs in those organs in which cells have lost the ability to divide. For example, the skeletal and the cardiac muscle cells. However, this hypertrophy can occur together with hyperplasia, where in hyperplasia the cells are increasing in number, which is causing a result of the increase in size of the organ. Yes. So, what are the causes of hypertrophy? The causes of hypertrophy are basically increased functional demand and also specific hormonal stimulation, as we shall be seeing down there, explaining those ones. So we have the adaptive response, how the cells respond to adapt to hypertrophy. So we know basically hypertrophy mostly occurs in muscular enlargement in two settings. So the settings, these are the we have the heart muscles and the skeletal muscles, and you see that both these muscles that are here, so both of them are striated muscles. So, and cells, how they will respond, they will be responding here basically by just also like the same way we saw in atrophy, the same way even here cells will respond. So in this case, cells will not go to a smaller size, but they will expand to accommodate the functions based on the functional demand of the body, and that's the way they will also respond adaptive. Then we have classifications of hypertrophy. So hypertrophy is basically classified into two. We have the physiological hypertrophy and the compensatory hypertrophy. Physiological sometimes is what is caused by what we saw as the increased as the specific hormonal stimulations or by the hormonal imbalances. So here we shall be seeing organs increasing in size or their massive growth due to either interaction of both hypertrophy and atrophy or hypertrophy only. An example is in the uterus during pregnancy. That is an interaction of both the two. But then in development of muscles, it is only hypertrophy, where cells are just increasing in size position of protein and other organelles. Then we have compensatory hypertrophy. This one usually occurs in paired organs like the kidneys. An example is when one kidney gets damaged, the other will hypertrophy or will increase in size in a way that to compensate for the lost one, such that it can accommodate the demand. So in compensatory hypertrophy, the cause is usually the increased functional demand. That's what causes the expansion or the increase in size of these organs. What is the appearance of hypertrophic cells and organs? Grossly, what we see obviously is the organs becoming larger. But when you lift it, you will be seeing that these organs are heavier because of the deposition of these proteins. But microscopically, you'll be seeing increased cell size. So the cells will be too big that within even the microscopic view, you'll be seeing fewer cells. Now, what is the significance of this hypertrophy and the results? Number one result is that it will lead to increase the function of the organ. For example, as we have seen in the kidneys, that these kidneys obviously will do what? One kidney will increase in function if the other is damaged. Then adaptation is also another one, that the cells will learn to go to a new norm. Yeah, they will create a new norm on how they are going to operate, such that the body still functions normally. Then also we have pressure on nearby organs. This is a result of hypertrophy, in that when these organs expand, they are going to squeeze or exert pressure on the neighboring organs. And this will create patches on these organs if they are being dissected to see. Then lastly is the obstruction of whole organs. This is usually if the organ that is concerned where hypertrophy is occurring is a hollow one. So if the organ goes on expanding in size, if maybe the mucosa, the result is that there will be obstruction or occlusion of this organ. Give an example: if the hypertrophy is occurring within the GI system, basically the esophagus of the horses. So basically that the esophagus will block, and when it blocks, obviously the animal can either die because this will be expanding and squeezing even the trachea. Yes, so it can result to death. So thank you so much. This has been Cassandra Owen from the Innovate. See you again in the next session. Please subscribe to our channel. God bless you.